Greetings. My name is Ryan Mercado. I'm an undergraduate student in the University of Puerto Rico at Mayagüez. I study industrial microbiology, and I'm taking the technical communication course with Professor Sandra Rios. I will be talking about hospital-acquired infections, health and political issue in Puerto Rico. Based on studies and census made by the Health Department of Puerto Rico, nosocomial infections cause a significant number of deaths in Puerto Rico. Since Hurricane Maria hit, the number of these diseases has risen immediately after the hurricane and months after the island has fully recovered. This PowerPoint presentation aims to explain the rise of these diseases after Hurricane Maria and their political cover-up in Puerto Rico. This information is relevant not only for those people working in health-related fields, but to the general public because nosocomial infections are diseases that you catch in the hospital, and every person that visits the hospital is involved with this. This presentation will be divided into three parts. In part number one, I will explain what is a nosocomial disease, what group of people does it usually affect, and the significance in Puerto Rico based on the Health Department statistics. In part number two, I will discuss the incidence of these diseases before and after the Hurricane Maria, the investigation methods I used to make this presentation, and the political and biological problems presented. In part number three, I will present the suggestions to decrease the incidence and stop the government cover-up of this information.
First, we will start by defining what is a nosocomial infection. A nosocomial infection is a disease which is acquired in a hospital. These diseases are caused by opportunistic or resistant pathogens, such as methicillin-resistant Staphylococcus aureus, Candida albicans, Pseudomonas aeruginosa, Acinetobacter baumannii, and Escherichia coli, to mention a few. After Hurricane Maria, there has been a rise in the incidence of these infections in hospitals and a cover-up of the situation by hospitals and the government. These kind of diseases usually affect some people in particular. The usually affected are immunocompromised patients, such as HIV patients, elderly people, people receiving chemotherapy, and people receiving steroids. However, otherwise healthy individuals could be affected if they get immunocompromised, and compromising the immune system is not a hard task. A variety of factors like stress, diet, sleep, and medical treatments could be a culprit. Hence, healthy individuals should also be wary of nosocomial diseases, especially considering there has been a rise in this kind of infections in developed countries where antibiotic misuse is widely spread. In Puerto Rico, these kind of diseases are very important because the Department of Health establishes that two of the 15 leading causes of death are by nephritis, which is kidney inflammation, and sepsis, which is a blood infection. What this is telling us is that nosocomial infections are huge because these two are commonly results of infection with a nosocomial agent. There are also a variety of factors which can lead to a hospital covering up a sprout of these diseases. And a very important factor is that the most important and frequent mode of transmission of these nosocomial infections is by direct contact. That means that a sprout is most probably caused by employees who ignore or don't know the correct procedure. The second leading infection route is by droplet transmission. This occurs when droplets containing microbes from the infected person are propelled a short distance through the air and are deposited on a patient's body or on surfaces that then the patient can touch. This is also very troubling for hospitals since we trust them with our health and we trust them to keep their area clean. But a spread of these infections surely says that there is something wrong with the sanitation steps of the hospital. Another very important route is the common vehicle transmission. This happens when a patient receives a catheter or another foreign object transplanted into the body, such as a heart valve. The microorganisms grow around the film that is in those objects, and then they infect the person, causing a deadly blood infection. Because of the nature of these routes of transmissions, most hospitals don't want to tell the public the truth.
Now I will talk about the investigation methods. For the incidence increase right after the hurricane, I mean immediately after the hurricane, I used the local newspaper, El Nuevo Dia. I used the New England Journal of Medicine and a Harvard study. This graph found in this slide presents the number of deaths since July to compare for before the hurricane. The hurricane hit on September to December. In the third bar, you'll see that in September there is a spike, and this graph represents the number of people who died because of sepsis. So one can see the relation that immediately after the hurricane there was a spike in the death of these persons by this cause, sepsis. Even in that time, the government was not transparent about what was happening. When Trump, the president, visited the island, the governor only said that 64 people died. However, in the New England Journal of Medicine, they made a study and they showed that at least 4,600 people died because of hurricane-related causes such as diseases caused by nosocomial agents. Then the University of Harvard made another study and said that the people who died could have ranged from 800 to 8,000 people. So one can see the government is not happy about these statistics and will do anything to cover up. That's why for the second part of, of this slide, which is discussing the incidence increase time after the hurricane. Time after a hurricane means that the island already has power, it has water, and antibiotics a lot of months after, at least at January, February, and to this date. You'll see that for this period, I'll only use staff interviews because it is not documented. For this part, I asked hospital staff, has the incidence of nosocomial infections risen since Maria? I must say, because these kind of infections are only acquired in the hospital, most hospitals want to cover up some sprouts. The first person I interviewed, she's a graduated nurse and her position puts her in charge of all the other nurses in the floor. She told me, yes, the incidence has risen, especially the infections by Klebsiella and Acinetobacter. When we see that a patient is infected by one of these pathogens, we isolate them quickly, we quarantine them. The second person that I interview is also a graduated nurse, but her position doesn't put her in charge of other nurses. She's a regular nurse. She told me, they do not tell us, the staff, what is going on. Some people of the intensive care unit do see when other members are being quarantined, but they don't necessarily know why. Both of these nurses work in different hospitals in the southern region of Puerto Rico. It's clear that the incidence of these diseases has risen immediately after Maria, and it still is a high number. Now we will discuss the political problem involved in these diseases and Maria. Puerto Rican law orders that institutions give trimestry reports of nosocomial diseases to the Health Department of Puerto Rico, and then the Health Department of Puerto Rico is supposed to publish these reports in their web page. However, they are not to be found in the web page. I visited the health department in Rio Piedras and no one could help me. I called countless times to the health department and they never pick up. You can see here in the slide in the bottom two pictures is the number of the health department and a screenshot of my phone calling at different hours. Nobody ever answered or returned the calls. What this is a deliberate cover-up of these diseases by the hospitals and by Puerto Rico, because these diseases can easily be linked to malpractice and people not doing their job the way they're supposed to be doing it. It's better kept hidden. That's why they think. To make a quick, to make a recap of the whole presentation, we can conclude that the The nosocomial infections have played a key role in the deaths of Puerto Rico, shown by the statistics of the Health Department, where kidney inflammation and sepsis are two of the 15 leading causes of death. And Hurricane Maria has risen the incidence of these particular diseases. We can also say that the government has not done anything to prevent this, but has always tried to cover up the information, partnering with hospitals to not make this information public.
These problems are serious and they won't be solved by one, two, maybe three people. However, that shouldn't discourage us because there are simple things that we can do that can lower the incidence of these diseases and also help manage the political issue. Even if we cannot change completely the government that we work in, we can exercise our right as citizens and our right to make the law be enforced to help with this problem, which actually has a lot to do with my first suggestion, which is to monitor the publishing of the Health Department's nosocomial diseases report. Even if we cannot fight about all of the information that the government keeps from us, we can do something about this. My second suggestion is to have proper personnel monitor and prevent possible outbreaks in hospitals. If we have a team of people assessing, periodically monitoring the microorganisms found in surfaces, periodically monitoring the steps that each personnel takes if they are following the protocol, and if they make a plan for these hospitals to reduce the incidence of these diseases, it will work. They will lower. Those are solutions for the government and for staff in the hospitals. However, the problem is not only with the staff and with the government, it's also with the microorganisms, especially those that are being resistant to antibiotics. So my third suggestion is to allow more natural light to reach the hospital rooms because there are a number of studies indicating that UV light kills a lot of human pathogens and it's also free, so it's a very good option. The fourth is to conduct research in the ecology of microorganisms present in hospitals. Personally, I've done this. I've researched a numerous amount of papers and it has been found that in enclosed spaces such as hospitals, because the air keeps recycling and a lot of people walk in them, the amount of human pathogens are much higher than in the outdoor air. And maybe a proposal is to periodically and in a controlled manner increase the airflow of the hospital to lower the concentration of the pathogens inside of it. But that's not a law, it's just a hypothesis. But it's an example of the things we can do, and it's an example that if we research more into this field, we can find more solutions to these problems. So the best and the most important remark is to not ignore the problem. That will be all for this presentation, and thank you for your time. Goodbye.